All righty. Good morning, everybody. My name is Dave Lesick. I'm from the Illinois Department on Aging, SHIP, which is the Senior Health Insurance Program. I want to welcome everybody. This is a new format for so many of us during this time. A little bit about myself. Like I said, I've worked for the Illinois Department on Aging, SHIP. I've worked there 8.5 years. Prior to that, I worked for Medicaid for 14 years as both a caseworker and a trainer. We want to talk to you today and try to get out as much information as we can during these tough times. We're going to talk about Medicare Basics. We're going to talk about this upcoming open enrollment and how COVID-19 is impacting all of this. Now, normally, if we were sitting there face to face, I'd be saying, hey, who's on Medicare now? Who's about to start Medicare? Who's here to help family members and such? Unfortunately, we don't have that good thing. So I'm going to basically give you the basics and, assume everybody's kind of, they know a little bit, but maybe not enough. A lot of people look at this slide here and they say, hey, that's exactly how I feel. This is how I enroll in Medicare, giant maze. I'm going to try to give you the basics of Medicare so you can put the puzzle pieces together, about Medicare. What's Medicare A? What's B? What's D? What's C? And put those pieces together to make sense of it all. So if you do know about this stuff already, my goal would be that you picked up at least one new thing. If you know nothing about this stuff, my goal is that you will get the basics and understand the basics of it all. All right, what we're going to talk about today is what is SHIP. I told you I'm from SHIP. We're going to talk about what is SHIP. We're going to talk about the basic parts of Medicare. We're going to talk about Medicare's eligibility and the oh so important timelines. We'll talk about the different types of Medicare coverage. We'll talk about Medicare costs, Medicare supplements. We'll talk about programs for low-income assistance people. And then we will talk about how we're trying to navigate Medicare during this COVID outbreak. So there's a lot of different things that are happening and changing the way we're doing things, just like the Zoom meeting today. All right, and also just to give you a heads up, after each main section, we're going to kind of stop and see if you got questions and all that, but I believe Tammy has the Q&A section open for you to type in questions, but I'll also try to stop, after the big different sections and see how we're doing. Well, for those of you who don't know what SHIP is, Senior Health Insurance Program, we're with the Illinois Department on Aging. We were established in 1988. We are a free Medicare counseling program. We are run through the Illinois Department on Aging. Every state in the nation has a SHIP. We are federally funded to provide this free Medicare counseling. We don't sell, we don't solicit, we have no affiliation with any insurance agents, insurance products, any of that. Everything we do has to be totally non-biased. All we do is educate people about their Medicare. SHIP has trained volunteers throughout Illinois. We basically train counselors at hospitals, senior centers, townships, all kinds of entities out there. Some are people that work at these agencies. Other are true volunteers, people that want to jump in and help seniors. We've got over 265 sites throughout the state, and currently we have over 1,200 counselors. SHIP does one-on-one Medicare counseling with beneficiaries, family members, caregivers, and we help them enroll into programs and try to help solve all those questions they've got with all this complicated stuff. Now, like I'll talk about toward the end, things are a little bit different during the pandemic, and some sites are seeing people, other sites aren't. We're going to kind of be winging it here this year and helping everybody the best we can and get you guys squared away. All right, Medicare eligibility. One thing I like to tell people right off the bat is do not confuse this with Social Security retirement. Social Security retirement is that fund that you pay into and you get a retirement check after you retire. You can get it as early as age 62. That is a whole separate program. Medicare is the medical program from the federal government. It's for people who are age 65 and older. Certain people deemed disabled by the Social Security Administration, they become eligible after 24 months. Two other groups that become Medicare eligible are people with end-stage renal disease. That's kind of a whole different set of rules. So we're not going to go into that too deep. If you ever have issues with that, contact us. And the fourth category is Lou Gehrig's disease, ALS. Somebody with that disease is immediately eligible for Medicare because it's fast acting. So those are the four main groups of people that are Medicare eligible. Also, you either need to be a U.S. citizen or a legal resident with 5 years of continuous residence at the time that you apply. Your eligibility for Medicare is determined through Social Security. So if you had to apply, you do it through the Social Security Administration. Once you're approved for Medicare, then it comes over to CMS, Central Management Services, and your medical starts being managed there. All right, people hear about all these different parts of Medicare. What the heck is this? One of the easiest way I found to understand these different parts of Medicare is to think of it as what part of Medicare is paying for this service. You've got parts A and B, that's original Medicare. When people get that red, white, and blue card, part A pays for your inpatient hospital services, okay, for when you're in inpatient hospital. Part B pays for all other medical, your doctor's appointments, your durable equipment, your labs, your x-rays. Most people need a Part D drug plan. I guess it's the only one that makes sense, D for drugs. So they have to get a drug coverage. And then moving back up, Part C, which we'll talk about, that is what we call Medicare Advantage. It's the same things that A, B, and D give you, but it's wrapped up into one managed care program through one health plan. So it's just another way of getting your Medicare. So those are the different parts of Medicare. Now, one of the biggest and most important things I tell people when it comes to Medicare is timelines are crucial. So many times we deal with people that call us up and they're in crisis because they missed a timeline. You cannot just sign up or just make changes anytime you want. There are certain times that you can sign up, certain times that you can make changes. I always say my favorite phone call to get is somebody who's calling me up saying, hey, I'm going to be starting Medicare in about 6 months. I want to look ahead, versus somebody calling me up saying, hey, I missed this. What can I do? So we try to get as much education out there as we can. But like I said, timelines are crucial in Medicare. There are specific times that are set up for enrollments. So we're going to briefly go over those. Well, I guess first we're going to show you your Medicare card. One thing I mentioned earlier is that when you enroll into Medicare, it's through the Social Security. You will get your enrollment package. You should be getting it 3 months before you turn 65 or 3 months before your 25th month of disability if you're on due to disability. And you should get a welcome packet telling you what's going on. All right, let's go to the enrollment periods. When can I initially enroll into Medicare? The initial enrollment period, the easiest way I tell people to remember this, it's the 3-1-3 rule. Now, for my examples, I'm going to always use the age 65, but just remember the same rules apply for somebody who's on due to disability. So 3-1-3, I'm eligible to sign up for Medicare 3 months before I turn 65, month of my 65th birthday, and 3 months after. So you got a 7-month window. That is when you can sign up for Medicare. Now, just an FYI, the best time to sign up is that 3 months prior. Because if you sign up in that 3 months prior, your Medicare will begin on the first day of the month of your 65th birthday. You can still sign up during those final 4 months, but your coverage is delayed. If you sign up during your birth month, it's delayed by a month. You sign up the next month, it's delayed by 2 months. So you're still eligible, but there's a delay. So your best time to sign up is the 3 months prior to your 65th birthday.